Reactive attachment disorder.
RAD is a condition in which a child is unable to establish healthy attachment with their parent or primary caregiver. It occurs when a child is consistently unable to connect with a parent or caregiver, and the child repeatedly feels abandoned, isolated, powerless, and uncared for. This can happen for many reasons. A baby cries, no one responds. The infant or young child is hospitalized or separated from its parents. A young child or baby is mistreated. The parent is emotionally unavailable because of depression, postpartum, illness, or substance abuse. A baby or young child is moved from one caregiver to another, the result of adoption, foster care, or the loss of a parent, for example.
Let's take a look at one family's story. Jim and Diane wanted to start a family, so they decided to adopt a child. They traveled overseas to an orphanage. It was crowded and the staff was overwhelmed. Jim and Diane brought home a beautiful daughter. Soon after, they noticed that something wasn't quite right. Their daughter did not behave the way the childcare book said she should. Jim and Diane took her to many specialists. They eventually got a diagnosis of reactive attachment disorder. When she started school, her teachers needed to develop an individualized education plan.
Hold on, let's learn more about RAD first. Reactive attachment disorder can occur when a child is unable to establish healthy connections. A child with an attachment disorder feels unsafe and alone. A diagnosis occurs after the age of 9 months. Signs and symptoms appear before the age of 5. Serious social neglect is a diagnostic requirement and the only known risk factor. The majority of neglected children do not develop the disorder. The DSM-5 criteria include a consistent pattern of emotionally withdrawn behavior toward caregivers, shown by rarely seeking or not responding to comfort when distressed. Persistent social and emotional problems. Persistent lack of having emotional needs for comfort, stimulation, and affection met by caregivers. No diagnosis of autism spectrum disorder.
Some of the characteristics in youth include an aversion to touch and physical affection, control issues, anger problems, difficulty showing genuine care and affection, and an underdeveloped conscience. The earlier the treatment starts, the better the potential outcomes. However, there have been few examinations of standard treatments. Some treatment strategies include encouraging development, consistent caregivers, positive environment, and addressing all needs such as medical, safety, and housing.
School strategies for students with reactive attachment disorder. Communication with parents should be given extra attention. Parents need to hear positive reports about the gains their children are making, as well as the remaining challenges.
A structured environment with rules designed to be simple, consistent, and predictable. Avoid demonstrations of affection. It is imperative that the boundaries between staff and student are maintained. Reduce transition time and increase open-ended activities, checking in regularly and providing the child with support.
Curriculum about social skills and problem solving, with an emphasis on learning about one's feelings. Play games that allow children to practice self-regulation, especially during outdoor time. Above all, communicate directly, positively, and firmly. While there is no cure for reactive attachment disorder, with proper supports in place designed to assist and strengthen the child's environment, they can learn to trust others and lead healthy and productive lives.
Created using Powtoon.